Put it back on. Dr. Stanley is wonderful. And he and I are best buddies. And you know, he trained me. And so he is absolutely right, because although the blood sugar is a little high, it can drop very fast. And I'm sure there are many of you in this room who have seen blood sugars going from 150 down to 50 in an hour.
Less than an hour.
Yeah. So when you're on a program, you sort of really have to stick with the program. Now, you know, if your blood sugar was 40, would you be in a bigger hurry to give that next shot? Obviously you would.
Yeah.
But I wouldn't skip the shot.
No, not
now,
skipping it.
really, the other question is can a high blood sugar give you a low blood sugar later on? And the answer is, really depends on your disease state. But there are many different pathways to secrete insulin. And so if one of the pathways is broken, but the other ones are intact, then you might, as a result of a high blood sugar, have secretion of insulin later on. But if you were to look at the risk ratio of giving the medicine versus not giving the medicine, you're far more likely to go low if you don't give the medicine, and then the worry that you might go low later. So as usual, Dr. Stanley is correct. And believe me, I know this from personal experience.
Sure.
But you know the way in schools you're not allowed to use a red pen anymore? Yeah, well, nobody told Dr. Stanley that for his fellows and trainees. You have to now in schools in California use a purple pen because it is less upsetting to the children to criticize them in purple than red. And welcome to America for those of you in the UK.
I thought that was funny.
And we always ask this, but I think I already know the answer. We don't have anything to compare to, because every case is different. So we always want to know, like, how is he doing? Like, in your opinion, like, how do you think he's doing? And you know, Dr. Stanley, I haven't seen him in a while, but you know, he always just says good. He's doing good. But like, we don't have anything to compare it to, so how do we really know how he's doing compared to others?
Okay, so the question is how do you know how your child is doing compared to other children? Well, there's two ways to look at that. The real issue is that if your child is neurodevelopmentally normal, meaning is meeting all the milestones at the right time, is not blind or deaf, so is able to hear and see and speak and walk, and has good muscular control, then you should be as happy as you could be that he's doing well. Now, the second component to that is at what price are you paying to get that degree of normality? So for example, if you're having to check the blood sugar with a continuous glucose sensor that measures the blood sugar all the time, and having to feed your child every half hour or on continuous tube feeds, now you've got a lot of work going on the one side, so that's hard, but you've got a normal child on the other side, so that's wonderful. Or you could, on the other hand, be taking diazoxide 5 milligrams twice a day and your child's doing fine. You know, it's all relative how you're doing.
Okay.
So I think personally the most important thing is neurological function. So if you've got a normal child, that's a huge blessing with this disease when you consider that 1 in 5 are not. And number 2 is, what's your daily program like? So if you can manage the daily program and keep on doing what you do in your life, then that's wonderful. And you know, different people's expectations are different. So some people might say being on a tube feed all the time and not being able to leave the house and always having to do blood sugar testing is acceptable, and some people say I couldn't do it. So so that's why I say, you know, I think the most important thing is how your outcome is going. And so this is one reason why, you know, study groups like mine want to study all our families and see how their outcome is doing. You know, we like to get IQ testing done formally at the age of 5 because it's really hard to say that someone's absolutely normal before the age of 5. It's easy to say they're abnormal, but it's hard to say they're normal. And so at the age of 5, you're at that point where you can do testing that will enable you to see, does your child have good reading skills and the ability to do math. I'm not saying they can do math at the age of 5, but there are ways that we can test that will tell us if the skills that you need to do math are there. And if you're missing any of those skills, then you want to start intervening at the time of school. So I'm a big believer in full-scale IQ testing at the age of 5 if everything is looking good, and then afterwards as needed. Any other questions?